Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we are looking at the drugs which are discontinued. So drugs which are discontinued, this will be prior to the surgery. Prior to the surgery. So what are these drugs? First is in case of the topical medications. So how is topical medications? So the topical medications, they are to discontinue on the day of surgery. So you discontinue. So discontinue on day of the surgery. Next is the diuretics. So this diuretics except the thiazides. So there is an exception, that is except the thiazides. So this again is discontinued on the day of surgery. Next, moving on to the oral hypoglycemic agents. So oral hypoglycemic agents. So again here there is an exception. So oral hypoglycemic agents, so there is an exception, that is except the SGLT2 inhibitors. So except this. So this is again discontinued on the day of surgery. So you discontinue on the day of surgery. Next, we move on to the SGLT2 inhibitors. So the SGLT2 inhibitors. So this SGLT2 inhibitors, you have to discontinue 24 hours before the elective surgery. So 24 hours. This is for the elective surgery. Next is you also do 72 hours. This is 72 hours. So one is 24 hours. This is before elective surgery. Then 72 hours is before the intermediate to the high risk. So in case of intermediate or the high risk surgeries. Next, we move on to the drug sildenafil. So sildenafil you have to discontinue 24 hours before the day of surgery. So 24 hours before surgery. Next, moving on to the NSAIDs. The NSAIDs are discontinued 2 days before the surgery. So that is, you have to discontinue. So discontinue will be 48 hours. So discontinue 48 hours. This will be before the day of surgery. So this is before the surgery. NSAIDs is 48 hours before the surgery. Next is, we move on to the warfarin. So this warfarin is discontinued 4 days. Warfarin is discontinued 4 days. So this is 4 days. It is discontinued 4 days before the surgery. And the exception is for patients who have cataract surgery without the bulbar block. So example, the exception is cataract surgery without the bulbar block. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.